degree of enhancement. As I said before, we did a real-time comparison between pancreatic enhancement and enhancement of the common or external iliac arteries. It was classified as intense when you have found an enhancement of the pancreas graft was similar to the iliac artery. On the left, we can see the pancreas with an intense enhancement, and here the iliac artery. On the right is the drawing of the same study, and we can identify the pancreas graft and the iliac artery here. This is a short movie of intense enhancement. We saw the iliac artery here and the pancreas graft with an intense enhancement of parenchyma. Moderate enhancement, when you found lower enhancement of pancreas graft in comparison to the iliac artery. An enlarged pancreas here with moderate enhancement and the iliac artery here. On the drawing is the same aspect of the left. It's a short movie. We can see the iliac artery here and an enlarged pancreas here with some pseudocysts inside the pancreas graft. And in this case, the patient present pancreatitis. Minimal enhancement, when you identified a few vessels and minimal enhancement of the pancreas graft. On the left, a small pancreas, a hypoechoic aspect of this pancreas, the iliac artery here, and the drawing showing the same situation, the same findings. A small pancreas graft with irregular contours and the iliac artery here. In this case, with minimal enhancement, there are 4 cases of these situations, all of them with chronic rejection. This is a short video showing the iliac artery here and a small pancreas here with irregular contours, small size, and hypoechoic aspect of it. This is a case of chronic rejection. Results. In summary, echogenicity and size were statistically significant on a grayscale study. Enhancement pattern and degree of enhancement were significant too. And we see an increase or a decrease in size. It's more frequent in patients with abnormal clinical status. Heterogeneous enhancement increased the risk of abnormal clinical status about 14 times. It's 14 times higher, and you found heterogeneous enhancement. Some parameters were not significant. The diagnostic performance of perfusional assessment of pancreas graft using contrast-enhanced ultrasound. The sensitivity was 100%. Specificity was 72%. Positive predictive value was 36.4%. Negative predictive value was 100%. And accuracy of this test was 75.9%. Discussion. Based on the results presented, we can see that nowadays we have some limitations for perfusional characterization with different imaging methods such as CT and MRI. And contrast-enhanced ultrasound permits the assessment of tecidual perfusion, and it can detect low flow. As a simple method, it can be performed in a bedside scenario in a real-time study. Let me explain a little bit about chronic rejection. The definition of chronic rejection is the gradual function loss at least 2 months after transplantation. The exocrine component is the first component altered, followed by alteration of endocrine component. The patient presents hyperglycemic episodes with acute severe rejection episodes in a short period of time. On histology, we can characterize concentric thickening of small artery walls, fibrosis of the acinar, and acinar atrophy. Chronic rejection is a diagnostic challenge. There are few descriptions on imaging studies, and in our cases, we have found a small size and low enhancement similar to computed tomography study, and maybe contrast-enhanced ultrasound can be used for evolutive perfusion analysis, baseline exams followed by some exams in follow-up time of pancreas graft. In conclusions, enhancement patterns between normal and abnormal studies were identified. There are no difference between pathologic situations such as acute pancreatitis and acute rejection. Grayscale ultrasound allowed to distinguish between normal and abnormal pancreatic grafts based on echogenicity and size. Contrast-enhanced ultrasound also helped to distinguish between normal and abnormal grafts based on enhancement patterns and degree of enhancement during the arterial phase of dissemination. We are very optimistic with the perspectives of contrast-enhanced ultrasound. We can develop an imaging protocol using grayscale ultrasound, contrast-enhanced ultrasound, CT, and MRI with different approaches. Contrast-enhanced ultrasound can be studied for a long-time evolutive perfusion analysis with baseline exams and follow-up. Now, it's available some perfusional quantification softwares for evaluation of the pancreas graft, and maybe grayscale ultrasound with contrast-enhanced ultrasound will avoid any further imaging studies such as MRI and CT in some situations. Here is a perfusional software where on the left we can see the contrast-enhanced ultrasound arriving at the pancreas graft. This is the interest area, and here we can see the uptake of contrast-enhanced ultrasound on the pancreas graft. Thank you very much.